The aim of this video is to show the practitioner how to perform the weekly dressing change of a PICC line. Practitioners should make an assessment of the appropriateness of the intervention, the wellness of the patient, any potential contraindications showing on screen now, and the patient's nursing, medical and line care pathway notes should be reviewed. Preparing the environment, you should ensure you've got space, light, treatment trolley, nurse call button, hand washing facilities, personal protective equipment and cleaning wipes. Preparing the equipment using aseptic non-touch technique practice and washing hands as per hand washing policy. Introduce yourself to the patient and gain verbal consent. Preparing the patient is crucial. Do they have any concerns or questions? Have they got any allergies? Maintaining their privacy and dignity whilst achieving a comfortable position with the use of a pillow if necessary. Checking their ID bracelet or 3-point verbal ID. Clean the trolley with a Clinell wipe and then apply apron and gloves. Clean 2 blue trays with a Clinell wipe or suitable alternatives in the community setting. Prepare all the equipment using aseptic non-touch technique. Preparing for a dressing change, you should prepare a sterile field using a dressing pack if available. If not, you can open the products into the clean tray. For this procedure, you will need 1 CHG tegaderm used for high-risk patients, neutropenic or known MRSA, or an alternative transparent dressing, 1 securement device, stat lock or grip lock, 1 ChloraPrep tint stick, 1 pack of sterile gauze, 1 ampule of sterile water, and an MRSA swab, 1 clinical laminate sheet. You may also need a Clinell skin wipe or ChloraPrep vial to remove the stat lock. If you aren't using a dressing pack, you will also need a set of sterile gloves for the procedure. You may see 3 different types of securement devices in the trust: stat lock, grip lock and Securacath. Place the clinical laminate sheet under the patient's arm. Before removing the top dressing, keep in mind that the dressing should be removed in an upwards motion from the port valve end towards the upper arm in the direction of the PICC line. This is to avoid any dislodgement of the line and maintain its position. If you are finding the dressing difficult to remove, you can use some of the sterile gauze dampened by the sterile water ampule to moisten the dressing to avoid pulling the patient's skin where able. Once the securement device and the hub of the line is exposed, one hand should be used to secure the hub site. Unclip the stat lock or unvelcro the grip lock. The securement device also needs changing weekly. If it is difficult to remove, a Clinell wipe or ChloraPrep vial can be used. Maintaining control of the PICC line and its position at all times with one hand. This is to avoid any movement of the line or introduction of external bacteria into the insertion site. Remove the gloves, re-gel your hands and now put on the sterile gloves. Maintaining control of the line, take the MRSA swab and perform your weekly line site swabbing. Next, take the ChloraPrep cleaning stick and, working from the inside to out, clean the area thoroughly, ensuring line position is maintained. This should be allowed to dry for at least 30 seconds. Take the securement device. The stat lock has a wipe which helps the device to stick to the skin. Wipe just underneath the hub. Place the securement device as close to the insertion site as possible and secure the line and hub in place. This may mean withdrawing up to ½ centimetre to be able to secure it, but never reintroduce the line back into the patient. The top clip should be placed onto the stat lock to provide maximum securement. Next, take the top dressing, either the CHG tegaderm or transparent alternative. The CHG square should be placed over the insertion site and top part of the line hub. The CHG square offers 7 days of antimicrobial protection in patients that are more susceptible to infection or known to have infection. The transparent dressing should be placed to evenly cover the insertion site and securement device. Once secured, the dressing should also be dated. as a visual reminder of when the weekly changes are required. Recheck the clamp is securely closed and show the patient. Dispose of all waste, remove gloves and aprons and wash hands, and then complete any paperwork necessary, including the trust line care pathway.